Kensington, Philadelphia, is often referred to as ground zero for the homelessness and overdose crisis in the United States. In recent years, the area has become emblematic of the destructive effects of opioid abuse that combine a variety of factors, ranging from extreme poverty to limited access to mental health services. However, there are unique dynamics that distinguish the homelessness and overdose crisis in Kensington from other areas in the U.S. First, the homelessness crisis in Kensington is not only caused by job loss or housing shortages, but also by the borough's direct involvement in the illegal drug trade. Kensington is known as a major drug distribution center on the East Coast, attracting drug users from all over the country. This creates a kind of unique ecosystem where homeless people are not only local residents, but also people from outside the city who come looking for easy access to drugs like heroin and fentanyl. Many of them end up stuck in Kensington with no way to go back or escape the cycle of addiction and poverty. Overdoses in Kensington have also registered a worrying pattern. Fentanyl, a synthetic opioid that is much stronger than heroin, is one of the main causes of the increasing number of overdose deaths in the borough. Fentanyl is often mixed with other substances, such as xylazine, known as tranq, an animal tranquilizer increasingly found in Kensington's drug supply. The combination of these substances not only increases the risk of fatal overdose, but also causes terrible side effects, such as festering skin wounds and chronic infections in users. In addition, Kensington is characterized by open camps where drug users often consume illicit substances openly. These scenes see people losing consciousness on the streets or huddled in the corners of neighborhoods with syringes in their hands. While striking, these situations create challenges for authorities and health services, as interventions are often hampered by stigma and security concerns. One other unique aspect is the response of the community and local organizations in Kensington to this crisis. Some organizations, such as Prevention Point Philadelphia, have provided harm reduction services, such as sterile needle distribution and naloxone and overdose antidote distribution programs. However, many of these efforts have faced resistance from local residents who fear the impact of these programs on their quality of life. Residents often feel trapped in a neighborhood surrounded by chaos, while homeless people and drug users are often perceived as a threat. Kensington's homelessness and overdose problems are the result of a combination of inadequate public health policies, gentrification that marginalizes poor residents, and an economic system that fails to provide basic security. and an economic system that fails to provide basic security. However, what makes Kensington different is the intensity and openness of this crisis, a view that is usually hidden in other boroughs. In Kensington is the visible face of a larger systemic problem. Behind the dire statistics lies a complex human story. Many of Kensington's homeless are victims of past trauma, loss of family, or a system that doesn't provide support when they need it. Addressing this problem requires an approach that goes beyond short-term fixes, such as providing temporary housing or drug rehabilitation. Kensington needs deeper solutions addressing the root of the problem through access to affordable mental health care, housing system reform, and more humane policies towards drug users. Ultimately, Kensington is not just a place, it is a reflection of a national crisis that requires serious attention. It reminds us that homelessness and overdose are not individual problems, but community issues that require solidarity, understanding, and action. Amid these challenges, there is a glimmer of hope. Various local organizations, such as Prevention Point Philadelphia, have been working to provide services like emergency shelters, harm reduction programs, and pathways to health care and rehabilitation. Although the results have been limited, these initiatives demonstrate that change is possible. Additionally, advocacy groups are pushing for policy changes, such as increased affordable housing and expanded mental health services. Homelessness in Kensington reflects broader issues of social and economic inequality in the United States. Addressing it requires a holistic approach involving government policy support, active participation from local organizations, and public awareness of the importance of social solidarity. Kensington is more than just a location. It is a reminder that behind the statistics are human beings in need of attention, empathy, and real solutions. Kensington has evolved into a symbol of the modern homelessness crisis in the United States. Over the past decade, the neighborhood has become the epicenter of a complex social crisis, combining homelessness, substance abuse, and mental health challenges. The homeless population in modern Kensington is not merely a reflection of economic poverty, but also a result of broader social shifts, including unaffordable housing systems, inadequate healthcare services, and controversial drug policies.